we have nothing. If we don't have our health, we don't have an economy. And my friends, we're here to ask the federal government to step up to the plate. We need 35% funding. That's $70 billion. We've seen healthcare costs escalate overwhelmingly throughout this pandemic. No matter if it's backlogs on surgeries that Ontario's facing, over 180,000 backlogs throughout this pandemic. Long-term care, we need to look at capital spending as well. New hospitals, new long-term care, more staff. That's what we need, because no province, it doesn't matter if Ontario being the largest province or not, we can't sustain it. We have a system that is broken. When it comes to healthcare, we have the best doctors anywhere in the world. We have the best nurses, the best PSWs. These folks are the frontline heroes that have been working their backs off day in and day out throughout this whole pandemic. And even before the pandemic, they're working their backs off. But we need the support. We need the support to hire more nurses, to hire more PSWs, to get more doctors, to make sure we can keep a healthy system. I'm sorry. With the long-term care, I'm going to use the Ottawa, because we have an outbreak in Ottawa right now at West End. We've sent in the hospital take over the long-term care, but the ownership of these long-term care companies, they have to take responsibility. And I'm calling out extended care. They have to take responsibility. They're a good company, but we want to make sure that the frontline healthcare workers are protected until they can protect the patients. It took one long-term care worker to go in there that was infected, and it went through there like an Australian bushfire. It's absolutely critical that the heroes, I call them the heroes, and mostly PSW workers, get tested, constantly being tested. And I've always said, and it's easy to sit back and talk about it, but we're going to put action to the words. PSWs in the province of Ontario are underpaid, overworked. And until we bring up the pay, which we're doing, because I'm all over health right now to get this through Treasury as soon as possible, we can attract more people. You know how tough it is? We have other areas within our province. I hear some people complaining. And I'm thinking, really? Why don't you suit up, be a PSW for a few days, go in there, see what they have to deal with, putting their community and long-term care ahead of themselves. That's what I call heroes. And doing it over and over and over again and getting underpaid. The system was broken for years, but I promise you one thing, and I promise the people of Ontario, we're going to take care of our PSWs. We're going to give them the tools to go in there. We're going to make sure that they have the PPEs. I'm going to make sure they have the N95 masks in there to protect them. Because it's my job to protect every single person in Ontario. And make sure a priority of the frontline healthcare workers are protected. And I just want to give you a message to PSWs. You're absolute champions. I love you. I've had an opportunity to sit down with leadership at PSWs yesterday. And we have their backs. And they're common from leadership. You're the first government, the first premier that's ever stood up for the PSWs. I'll always protect them. I see it firsthand. My mother-in-law is in long-term care home. My wife's there every single day supporting the frontline healthcare workers and taking care of her mother. She told me a story yesterday, and I saw her walking out, and I told the leadership PSWs yesterday, Carla had, my daughter, as Jason knows, makes cookies, right? Little guy cookies. Well, she's walking out with 3 boxes of cookies, big boxes. And I said, where are you going? She goes, I'm going up to see my mom, and I'm going to show my appreciation. This is for the day shift cookies, these are for the afternoon, and these are for the evenings. It seems small, but it shows appreciation. And when I went there, they all came outside, and the stories they told me are staggering. It's heartbreaking. Listening to these PSWs, a lot of them new Canadians, trying to put food on their table for their families, paying rent, in some cases paying a mortgage. But I'll never forget this one lady came up to me. She goes, I need more hours than 37 hours a week. And I thought, God bless you. She's working 37 hours and to provide, and she was a single mom, to provide for her family. If we could give her 60 hours, she'd take 60 hours. Because there's a lot of other people that aren't in that dangerous type of setting that aren't even willing to work 40 hours. They'd rather take the government money from the government. And then we have these other PSWs that are working their backs off and willing to stay and put their, literally, they're in some cases, their lives in jeopardy. And my heart breaks that we lost 6 PSWs throughout this pandemic. The hurt that their families must be going through. And all the people that may be complaining about their job, really? And in safe environments, start looking at some of the other heroes that have been working their backs off to save our most vulnerable.
We'll take next question. Last question on the